Welcome to another episode of the Myokinetix podcast. Today we have an awesome special guest, and this guest has been in the work for a long time. I'm super happy he's able to carve time out of his busy schedule and just come visit the clinic and actually sit down and have a meaningful conversation with us. So what we have today is Dr. Casey Pierce from Academia of Orthopedics, and he has been a friend of our practice for a long time, and we refer people back and forth, and probably one's the nicest guy, one's the easiest guy to talk to, and able to just break down science and medical information in like the most digestible form as possible. So Casey, thank you so much for joining the show.
My pleasure. Absolutely excited to be here.
I hope that intro does you justice.
Yeah, I think it does. I think it covers the bases. I like being referred to as kind of a normal person. I think a lot of times there's some aura about being a physician where people think they can't just talk to you like a normal day. And one of my favorite things is I get to go to my kids' baseball games and talk to people like I'm not a doctor for 20 minutes a day, and that makes me happy. So I hope I can treat my patients the same way. And
that's huge, right? Because I think in the medical field now, as you see that in the past, I think the role of medical professional was to be like we came from like the old school of like if you go to one doctor, that's your family doctor,
sure,
right? And it was really relationship based, and then as healthcare get more and more advanced, we also become more and more volume based. And I feel like we kind of lost touch in that a little bit.
I think also there's that old idea that the physician is a paternalistic figure where it's do as I say and don't question me. And now with the technology area and social media era where you have so many options and so many sources of information and vast knowledge, literally the tips of your fingers in your phone or your computer, people are much more educated. So relying on a doctor's opinion without ever actually looking into it, those days are gone. You have to be able to back up what you say now and express opinions and give advice that other physicians will back you up on, and that also patients can look up and find that it's evidence-based. So I think having that outreach and being accessible and, communicating with your patients through a variety of media forms, whether it's podcast or Instagram or Facebook or even just reaching out and making an old-fashioned phone call, that's got to be part of your repertoire as a physician and as a surgeon especially.
Seem like you value communication a lot when it comes to
I do, which is funny because if you ask my parents, I was a super shy kid growing up that wouldn't even make phone calls, and asking a girl on a date was something that was beyond me until I was in college. So the fact that now I feel comfortable being on a podcast or giving speeches in public or talking to other groups of physicians, especially in a professional setting, I guess it's maturity or something like that. Even though I still don't think of myself as much.
Well, I think you probably have way more to say now, and then you have a lot of people who are also looking to hear what you have to say.
Sure, yeah, and I think one of the things I tell people about my job is I'm one of those people that genuinely enjoys my role as a physician and my job. I like going to work. I like talking about my job. I don't mind when people ask me questions at, social functions or parties or just, at a baseball game, because I enjoy what I do and I like giving people help wherever I can, even if it doesn't have some sort of financial benefit for me. It's just something I like talking about.
Yeah, and I love
that.
Drives
my wife
nuts. Yeah, because then you would strike up conversation with anyone.
Well, she's an obstetrician, so when her and her dad get talking, because he's one too, I back away from that. So every once in a while I get my chance.
Yeah, there you go. So let's backtrack a little bit. So let's talk about your journey becoming, an MD and what you do right now. How did that path start?
Sure. So I think I'm a little different than the standard, physician in terms of how I got to where I was. I come from a family of attorneys. So I was always, the quiet kid that didn't have much to say because my brother and my dad and my, now my sister-in-law, but my grandfather and my uncle were always the ones talking because they're attorneys and you just never win an argument growing up. So when I went to undergrad, I actually started in the Air Force. I went to the Air Force Academy for a year before realizing that maybe I wasn't the Captain America figure I thought I was. And I had seen Top Gun just too many times, and I didn't meet a guy with a mustache and start flying F-14s right away. So once I got out of the military, I went to Colgate having no idea I wanted to go into medicine. I was more interested in playing intramural sports and just having a good experience in college. And then kind of towards the end, I started thinking maybe med school. So, ended up taking some classes and doing some things to bolster my resume. But I ended up actually going to New York Medical College and doing a part, at least, of a master's in pharmacology before getting accepted into St. George's. And St. George's, for people who don't know, it's a Caribbean med school down in Grenada, so in the very southern Caribbean islands. Which isn't a bad place to live. You're on a Caribbean island and it's beautiful and sunny and 80 degrees every day, but it makes your journey into a highly coveted specialty like orthopedics much more different. So when I graduated med school and applied for orthopedics, no one would look at my application because I was branded this foreign medical graduate, which in my mind is something I try and push back on now. I mean, I thought I was a pretty good candidate. Yeah, I didn't go to Harvard or Yale, but I knew what I was talking about and worked pretty hard. So I was fortunate that I started applying for other opportunities, and I went and did a year of research in Vail, Colorado, at a place called the Steadman Philippon Institute, which is very well known for the surgeons there and the work they do. And thankfully, that was enough to bolster my resume to get me into a U.S. residency at Seton Hall, where I did my orthopedic training. But even now, that's something I try and tell kids. Like, if you want to go into orthopedics, or you want to go into highly, coveted subspecialty, you got to work your butt off and be willing to work for free for a little bit, or do some things where you're not getting, paid in the way you expect. And then through my residency, I got fantastic training and kind of this private slash, educational model, or private slash academic model. And then was fortunate enough to go do my fellowship down in Birmingham with the Andrews Group, which, that place is somewhere where the name stands alone. But the training I got there and the experience I had and the friends I made, and actually I have a lot of family down near Birmingham, was just incredible. And now I was fortunate enough to get a job back with the group that trained me, and some other surgeons who you're familiar with, and back in Jersey where my wife's happy. So here I am.
Yeah, I love that story, because it's definitely unconventional path,
Sure.
right? And I see a lot of parallels in my journey as well from myself, because I applied to one physical therapy school. It's happened to be a weekend program,
Nice.
right? And then that was demonized in some way.
Right, yeah.
And then what I did was I knew that going in. So what I did was I bolstered my resume by training with the best people. I would
Sure.
go volunteer my time, fly all over the country, see what's the best PT are doing at a professional setting, a different setting. Like, I went to the UK, I went to all these different places, right? And now it's not really what you do while you're in school, is what you do outside of school that actually give you the real world experience.
Sure, and I think that's a setting, or a saying that stuck with me forever. There's an old comedian named Adam Carolla, and he said, if you want to do something, you have to be willing to work for free. And when I worked in Vail, I was being paid, but I wasn't even paying enough to pay my rent every month. I was fortunate to have a wife who could support me at that time, but if I had to take out loans, I would have done it that way. And when I see younger, whether they're physicians or therapists, or just people that are trying to get jobs that I have some influence in, it really says something when you're willing to put that time in for maybe not the compensation, realizing that on the back end, it's going to have some benefit to you. That speaks to character and dedication and the kind of work you'll expect once they have the job they want.
Yeah, and I think there's also a different kind of pressure when you have that chip on your shoulder, and that you have to not only prove yourself right, but in a way prove other people wrong as well, which I think fast tracked my learning like so much. By the time I finished, I got my first job. I think I was probably one of the first new grad physical therapists that has a full caseload within less than 2 weeks.
Yeah. And I think it speaks to your personality too. People that have that drive tend to be able to get along with whether it's patients or clients or whatever it is, and build that ability. So I think that's when you're hiring someone and looking at resumes, things like that speak volumes, where other, awards or things that don't come with the same hard work necessarily look shiny but aren't the same glamour.
Yeah, so I love that story. So talk about how you start to figure out your specialty of what you wanted to do, as what kind of surgeon you wanted to be as you're unfolding that whole process.
Sure. Yeah. So a lot of times in orthopedics, people think you sign up to be an orthopedic surgeon and you kind of know what you want to do with that. They don't realize the broad spectrum that orthopedics covers. So orthopedics basically covers surgery on any bone or joint in the body, but also there's soft tissue components when you talk about sports medicine. So basically, when you come into orthopedics, you get this vast experience from foot and ankle surgery to joint replacement to spine surgery, plastic surgery techniques, hand surgery, sports medicine, and then, other reconstructive and pediatric things that are a little more in depth. So I was fortunate that my time in Vail was very focused on sports medicine, and specifically on the guy I worked with, is a guy named Robert Leprod, who's the kind of god of knee surgery and posterolateral corner reconstructions. So I got to do so many cadaver cases and, videos and things with him that I pretty much knew I wanted to do sports coming into my residency. So Seton Hall, when I was there, St. Joe's, when I was there, had this kind of unique ability, whereas you came through your first couple of years, you did tons of calls. So you get the general orthopedics, the ER stuff, suturing lacerations and taking care of dislocations and fractures. But then as you transition to your fourth and fifth years, your last years of residency, you get the ability to set your schedule more. So really my fourth and fifth years were kind of like almost a mini fellowship, where the vast majority of my cases were doing sports medicine related cases with some of the guys I'm partners with now, but also other surgeons that taught me along the way and really got me the experience and the kind of hands-on skills that I needed to translate into fellowship and being successful there. And then applying for fellowship, I knew what I wanted to do. And my choice basically came down to a couple places, but Birmingham was it was a no-brainer. I mean, the name of that place and the experience you get and the case volume you do, it was incredible. And how could you say no when they offer you that spot?
Yeah, it's like to the listener that listen to this, James Andrew is probably the most well-known orthopedic surgeon. I think
Sure.
the fact that when I went to the UK, everyone's like, oh yeah, like, have you visited the Andrews? I was like, man, like I'm in the UK.
It's the power of ESPN right there.
Yeah. No, because every time there's a running back that get injured, anyone is always James Andrew.
Sure. Yeah.
What is the experience like there, just being in that kind of place?
So I remember my first operative day there. The way they have it set up is a little different than a lot of ORs. You see like the classic OR where they have like a viewing room where people can sit around. They kind of modified that where they built 4 ORs in a square, and then basically in between them they put this connecting bridge where they have computer screens so you can see what's going on if they're using a scope, but also big viewing windows that are controlled from the inside with curtains that can go up and down, which is nice because you can have patients come watch or family members come watch their patients or their family member surgery, or you can have the surgeon viewing you as you're starting or stopping or finishing a case so they can make sure you're doing the right things. So I remember my first day in fellowship, I was standing there and he was about to scope a knee. It was a 75-year-old degenerative knee scope. We were just doing a little meniscectomy, kind of like a 1 out of 10 difficulty in orthopedics. And I was sitting there, like waiting for the surgeon to come in or waiting for the attending surgeon to come in. And all of a sudden this voice comes over. It's like God speaking to you. It says, Pierce, get started. And I'm like, all right, what do you mean? He's like, get started. I'm right here watching. Go ahead. And it's all right. And it's time to go. And that's the Andrews way. It's trial by fire. You got to do it or you're going to crash and burn. So day one, I'm starting cases by myself. And I got someone watching me to make sure I do the right things as I learn. But that was it. And you realize real quick that it's not residency where you may do 3, 4, 5 cases in a day. This is fellowship where it's a machine. You're going to do 15, 20 cases in a day. And if you can't make them move quickly and show that you have the technical and mental skills to really succeed, man, it's going to be a long year. So real quickly, you develop that skill technique and that skill set.
What would you say about that transformation process of you going in before that residency and you coming out?
Well, it's funny. My brother-in-law, who's I think about 3 years behind me, just finished his fellowship and starting his practice. So I've kind of always been that step ahead of him where I can give him the advice. And he was lucky enough to get an Andrews as well, 3 years behind me. So I guess I made a good impression. But, it's funny you ask that because I remember there were times when I was a fellow and then when I was a resident where I'd come home and I'd look at my wife and like, I can't do this. I just don't have the ability. I can't make the scope work the way I want. I should just quit. And thankfully I didn't. You get through those times and some of that sleep deprivation or just being tired and you realize you didn't really make as big of a mess of things as you thought. But I remember times thinking like maybe this is harder for me or maybe I got to learn. And then you figure out how to do things. You go through cases that are difficult, but when you look back, you realize you worked your way through it and you figured out how to do it better and faster. And now that I'm 5 years into my private practice, I don't struggle anymore for the most part. I mean, everyone has bad days and good days, but for the most part, I always feel like I can whip through cases and get them done efficiently, not rushing, but efficiently. And I'm constantly talking to my brother-in-law who's experiencing the same thing. And when he was in fellowship, he'd call me and be like, Case, I can't do it. I should just quit. They're going to hate me. And I said, look, man, this is normal. It's part of being a surgeon. It's part of your education. It's part of your growth. If you didn't have days like that, there's something wrong with you. It means you're already too good. And that just doesn't happen. There's no savants of orthopedic surgery. Everyone's got to learn by doing it and struggling.
Yeah. That's the biggest thing. It's a humbling experience for everybody. So, when we have like parents coming in, like asking us for advice and try to seek help and all that stuff, we always try to explain like there's different in quality of care everywhere you go, especially if you go to like a fellowship or like that, like Andrews, right? There's different quality of care. So can you talk into a little bit more of that? Like how, let's say if you know what you know and you were a consumer, you were talking to a friend and a friend happened to be in a different state, right? And how would you advise that friend to say, hey, here's what I would look for when it comes to find the right orthopedic surgeon that will fit your needs, especially for your kids or for yourself?
It's funny. I've actually been asked this a couple times, and I've kind of crafted my answer. It used to be like, oh, you look on the website or look on that. All that can be smoke and mirrors now. You can have a really good looking website. You can have some great patient reviews, good social media presence. what you do is you find some nurses that actually go in the OR. You don't ask other physicians unless they're also in the same specialty, because they don't see them operate. If you ask a primary care doc who their favorite orthopedic surgeon is, they'll tell you, but they've never actually seen him operate. So you ask the nurses that have been around there, or the nurses in the hospital that have seen the surgeon in the OR, how they handle good days and bad days. That's how you get your surgeon. Ask a nurse, ask a therapist for good outcomes. People like you and your specialty have some keys to the gate to get patients, my way or other surgeons' ways by recommendations, because you see what we do. If we do a bad job and someone has a bad outcome, you're the front line that you can either help us and make them better, or you can, show it off that it's not necessarily the right thing. And that tarnishes your opinion if they're not doing well. So good outcomes speak to themselves, but the people around you that observe how you operate and how your patients do, that's the key to finding a good surgeon. And just pick their brain.
That's a really good point. Yeah, because I remember when I was doing my rotation PT school, there's one rotation where I would be in the OR, but I would follow around this guy who was selling medical device, and then he would say like, "Oh no, you don't want to miss this one. This guy's good."
Yeah.
And I was like, "Oh, like, because that's all they do."
Sure. Well, in the medical reps, you got to be a little careful because they're biased. They want surgeons that use their products. So I'm sure all of the reps have good surgeons within them, but to find the best, you got to get that unbiased opinion.
That's true.
Therapists and nurses who see them. Yeah.
So now, like, obviously you're 5 years into your practice and you have been through all this training. Like, based on what excites you every day? How do you justify, like, hey, here's what I'm getting up, here's what I'm looking to do, here's my mission?
Well, you know what it is, look, away from medicine, getting up every day, seeing my kids and having my dog get up and run around with me, that's what excites me. But my job, it's different. So half the days I'm in the OR, half the days I'm in the office. In the office, I like seeing patients get better. I want to see the patient that's 6 weeks, 3 months post-op and sees the improvement and sees the benefit we've provided, or even not me provided, even if it's something that's non-operative or that someone else is taking care of. I want to see that benefit in that younger athlete, seeing they're getting better and that they're going to come back bigger, faster, stronger. In the surgical days, I want cases to go smooth. I want everything set up the right way, but there's also those days where not everything goes the way you want, whether there's equipment missing or, something doesn't go, and you kind of MacGyver everything together. And at the end of those days, you feel good about yourself. You kind of, hey, look what I did. I was able to make it work even when we weren't on our A game, or, hey, everything ran super smooth today and this is how you should do it. And I wish I made a video to show everyone this is the way it's done. Those are fun things. And part of the other experience I get, and I'm fortunate, is that I get to teach residents. And sometimes you get to do new techniques or different, devices or things like that with the residents because you can get that funding and that ability. And I love teaching those guys. It can be frustrating. And I'm sure there's days where I snap and bark at them because I want them to get better and be smarter. But at the end of the day, I really enjoy the experiences I get with them, whether it's off time having fun or actually in the OR teaching and kind of helping them further their career like someone did for me years ago.
Yeah, and I think and you are definitely one of the surgeons that we communicate with and really invest in the outcome of the patient. Like, like you always follow up with us to see how everyone's doing. So was that something that was always instilled in you as far as like just following?
No, that's part of the Andrews way is, Dr. Dugas, who was one of the main guys in the fellowship, used to give everyone his cell phone. And we would sit there as fellows and be like, what is he doing? He was giving parents his cell phone and everyone. And you realize no one calls you. When they call you, it's usually to send you someone or to tell you how great everything's going. No one calls you with their problems because they work through them and you get a good team around you. But that open line of communication, talking to therapists, talking to primary care docs or whoever it is, athletic trainers, agents, managers, whatever people have, that's part of the Andrews mantra is you got to make yourself available. You got to be the person they can call and depend on. If you don't answer your phone and you don't show up, doesn't matter how good of a surgeon you are. You can't be the good surgeon with a terrible personality. You got to be able to talk to patients and make them feel at ease, calm some of their fears, and show them your experience is going to shine through and make their outcome better.
Yeah, and this is why this is what I love telling parents who are listening to this, especially when they have kids who are going through surgery. It's like, listen, when you get a great surgeon, like, it's a point of anger of solving the problem. But if you have great connection with that surgeon, they can future cast and kind of project what that's going to be like down the road for your child at 6 months, 12 months, or even like 5 years, right?
Sure. But I think another thing parents have to understand is, surgeons control the OR. They have that control. But then really the next phase after surgery, even not after surgery, but after an injury, is it's a team project. It becomes therapists, trainers, whoever else takes care of that kid, and even parents and mental health, recovering from surgeries and recovering from injuries, especially for younger athletes that never had their body let them down before, it's a team effort. And if it's just surgical focused or just therapy focused, you're going to miss the mark, and it's going to take patients longer to recover, and they're not going to come back as strong, or they're going to be delayed in their outcomes. It's got to be that team approach where you treat not just the athlete, but their mental abilities and their family abilities to make them stronger and better.
I love that, because we talk about this all the time, because the team approach is always something that I saw when I went to see like what other professionals doing, because they have a team of people, right? They're like, oh, hey, here's a surgeon, here's a trainer. All right, let's all communicate together. Let's not work in silo, because at the end of the day, we want the best outcome for the patient, right? We don't want to pat ourselves in the back. All we want is like, hey, we're all just pretty much supportive characters in this patient's journey of where they want to get to. And I think the one red flag I always tell parents or anyone is like, if you have someone that's an end all be all for everything, I was like, that's not the person.
Well, and also you got to be receptive to learning. I mean, look, the surgeon attitude is I'm the smartest guy in the room. I'm the best looking. I'm the brightest star, whatever it is. You got to be available to think, hey, I work with smart people. Like if you were to call me and say, hey, I see this patient struggling with this, I'm not going to shut you down. Like, nope, I did this surgery. He's going to do great. You got to listen to what you say. And I've had plenty of therapists diagnose things that maybe I didn't see as clearly, or light something, in the back of my mind that reminds me, hey, maybe I should look for this and find something that was missed before. So having an open mind, whether it's to colleagues you work with, other surgeons, physical therapists, trainers, whatever it is, you got to realize that people have the ability to contribute no matter what you think, and be open to that. And that's better for the patient in the end.
So based on your experience so far, and we talked about this before, what are the most common injury that you've seen and that is now like the most struggle, especially for adolescent athletes?
Sure. So, I mean, if you look at literature, like the most common adolescent injuries, there's ankle sprains. But that's not something that usually requires treatment. Surgical injuries, I think, from my standpoint, depend typically on sports they play. So the big thing for orthopedists, in my standpoint, is usually football season. I take care of Montclair State, and we take care of tons of local high schools in the area. So football season is knee injury and shoulder injury season. That's when we see a lot of ACL, a lot of meniscus injuries, a lot of MCL injuries. And in the shoulder, we see a lot of labral injuries, whether it's dislocations or posterior labrums in big linemen, or even like the bizarre multi-directional instabilities you'll see in overhead athletes and volleyball players and swimmers and gymnasts and things like that. So it's a lot of shoulder injuries, usually intra-articular for the younger athletes, whereas you think more like cuff and extra-articular things for the older folks. And then a lot of intra-articular knee injuries like ACL tears and meniscus tears.
Yeah. And I know before that, we even talk about baseball too, right? As far as like just, little league elbow, UCL, because there's way more, because your son played baseball.
Yeah. Right? I have a 9-year-old who's full into travel baseball. And actually, it's funny. I don't know how far I should go into this, but one of the players on his team, one of them, when my son first joined the team, was recovering from a little leaguer elbow and had kind of a prolonged recovery. So his parents just, no pitching ever again. It's not happening. But then another kid, came up to me after a game and literally, grabbed a hold of my shirt and said, "Hey, Mr. Pierce," because he knows me as Mr. Pierce. And he said, "Hey, can you look at my elbow?" And I'm like looking around for mom or dad to see who told him to come talk to me. And he knew what I do, and he knows my son. So he came over and I looked at his elbow and I was like, this looks like he's got little leaguer's elbow. And I had to call his dad and tell him, hey man, you got to get this kid checked out. Like, bring him to the office, we'll get an x-ray. And he's not even a kid that's throwing in a huge amount of innings. It's just the strain on young elbows is, we don't know how much is too much. We have rules to try and block them. We prevent, excessive amounts of pitching and inning limits and pitch counts and no going from pitcher to catcher. But some of these kids, it's more, you just got to have parents that are watching every day. And if you see your kid dragging their arm or shaking their elbow, you got to maybe get them checked out or push on them or ask them how they feel. Yeah,
I think let's stay on this a little bit, because I love this, right? Because you're parents yourself. And I think, for the parents who are listening to this, like, what are some advice would you give them to make sure that their kids, because again, for me, it's we have this saying that, like, visibility beat ability, right? The more you stay on the field, the more people see you, the more higher likelihood of you getting recruited to play at whatever level you want to play.
Sure. Yeah. I mean, I think there's a couple things. And look, this is a topic we could talk about all day, but I think the big things is parents need to be educated. You need to understand that your kid pitching 60 innings a month as a 9-year-old is completely worthless. Your kid needs to be developed as an athlete when they're that young. They need to play other sports and have an off season. And I highly encourage patients and their parents to go online. There's a million resources usually provided through Little League and corporations like that. There's the Stop Injury Program, and they have kind of 5 or 6 good rules. And if you look at most of them, they're simple things. pitch counts, innings per month, but then things you don't necessarily think about. The number one risk for young athletes hurting their arms in a baseball situation or softball situation is pitching fatigued or throwing fatigued. So you need to have adequate rest. You need to not pitch when you're hurt, and you need to have a 4-month rest period. Number one way to prevent injury is don't play baseball for 4 months out of the year. Do something else. Go play soccer, basketball, go swim, go hike. I don't care what it is, but don't throw a baseball. Now you can still play with your friends and do all that stuff, and you want to play wiffle ball, but organized baseball needs to go away for 4 months. And that's a really tough thing to get parents to realize, is they don't need to have a private trainer that goes 12 months out of the year. They don't need to throw a ball, and pitch over and over and over again when they're this young. As they get older and they're trying to refine their skill, and they have the maturity and the skeletal maturity, as well as the coordination that comes with puberty and growth, that's when it's time to kind of hammer it home and really focus. But not when they're this young. That's just going to make them, first it might make them resent you, but more, it's going to make them more likely to get hurt.
Yeah, we always mention like athlete burnout all the time. It's like once you burn your kids out, especially in like travel sport, it's very hard for them to come back from that. Sure. Because then they lost the love for the game.
Well, and I think part of that too is encouragement, how parents talk to them. You can talk about the physical aspects of it, overdoing it, overplaying them, over coaching them. But there's also the mental aspect of it. You got to make it fun. If your kid thinks every time he strikes out that you're disappointed in him, or every time he gets a hit or gives up a hit pitching, you're disappointed, that's bad for the mental aspect of it, like we talked about. You got to be a positive parent, and that's hard. I mean, I got a 9-year-old, and when he strikes out, man, it hurts me inside, but I got to show him that, hey, it's okay, get back out there next time, and don't cry in the dugout. Go out there, show your teammates you care and you want to do it again. So mental health for these young athletes is just as important as the physical side, and watching them for injuries and things like that.
Mm-hmm. So again, just to hammer it on, as a parent for yourself, how do you stop yourself from projecting your expectation to your kids?
It's really tough. I mean, I got to tell you, I think I'm fortunate that my wife is an athlete too. And so I spend more of my time checking her because she's so aggressive. She's a hot-blooded Italian. She really wants her son to be the best. And anyone that doesn't think so is wrong. Whereas I'm more laid back. I'm Californian, and everyone always kind of gives me the hang loose sign and whatever. I think from my standpoint, I get checked by her. I see how aggressive my wife is, so I'm usually the one that's more reserved, trying to tell her to calm down. But I think you got to realize that these are young kids, and they should be kids first. And you got to put whatever your expectations, your goals for their life on the back burner and let them be kids. Mm-hmm. And that's something that takes daily, if not hourly, reminders. And you got to think every time you go to your kid's baseball game, you're not here for you, you're here for them. If they have fun and have a good time, it doesn't matter if they win or lose. It doesn't matter if they throw 1,000,000 strikes or they walk every player. That's all that matters. And as they develop and mature, then you can decide if they're going to play for the Yankees someday.
Mm-hmm. This is so true, just because, I, as a PT, I get to see kids go through like different transition, and I'm like, man, I'm getting old. I see all these kids growing, but I think what's cool is that you get to when again, like that, lets kids be kids is one of the best things, because by the time they are mature adult, like that's it. That's really no part of that anymore. And another thing too, to go back to parents feeling the pressure to, competing with the Joneses of like getting the trainers, all of that stuff. I think part of it, and I talk to parents all the time, and I say like, hey, listen, why are you putting them your child into all these things? And then as we're talking it through, they were just saying like, they just feel guilty because other people are doing it.
Yeah,
right?
That's a huge problem. And I think that's where it's hard to coach people about that, or tell people. And the coaches are the ones part of the problem, because they're telling you, hey, look, your kid needs some more training in this aspect that I can't give him every day. And patients feel obligated. And I think, honestly, for your kid's development, even if you're not an athlete, you weren't a baseball player or a basketball player, when your kids are young, you're still a better athlete than them until they get to a certain age. Take advantage of that. Teach them whatever you can. And then when they get to an age where you can't teach them, or you feel like they've progressed beyond your level, that may be when it's time to start thinking about the private coach. Mm-hmm. But I think personally, look, this is my opinion, take it for what it's worth, but I think it's better to dedicate your own time to teaching your kid than paying someone to, if you can teach them the same things. They get more from mom or dad showing them, as long as you're patient and somewhat gentle with them, than they ever can from a professional instructor. Mm-hmm. Once they get to a certain age and they're beyond your abilities, that's when it's time to recognize and let it go. But I watch my kids. They lost a game yesterday, and all the parents are devastated. The kids get a football, they go on the field and play football 45 minutes. You would think nothing happened. Mm-hmm. And sometimes that step back and realizing these are just kids, it's enormous.
Yeah, it's so funny you say that, because every time when I find out any of my athletes get hurt, I call the parents first, because the parents take it to heart. And another thing too is we talk about this all the time, especially with ACL injury, UCL injury, because you lose that identity of you being that athlete, right? So I think for parents too, you also have to be careful what kind of identity you're imposing on your child. Because if you impose that identity, like you're going to be the best baseball player, and if they, God forbid, they got hurt and that identity get ripped apart, then who are they?
Exactly.
And that's why it's detrimental. Like, and I think it's one of those things where like, hey, listen, great, you did well today at baseball, but guess what? You're still Johnny.
Yeah, you still got homework to do. You still got to feed the dog and, take out the trash.
Yeah.
Well, I think the other thing too is, even the college level. When I get college athletes that are hurt, I tell them, hey, you want to get mom and dad on the phone? Let's talk to mom and dad about your MRI results, about what we're going to do. Because they still should be involved. And your parents matter even when you're 50 years old. And with kids, the other thing I think is important for parents to realize is the great equalizer is not coaching and training and how much time you spend. It's puberty. Some kids are going to grow up big and strong, huge muscles. Other kids, not so much. And I think recognizing that and not trying to make your kid into something they can't be or don't want to be, even more importantly, is important for parents.
So for the parents who are listening that obviously might feel a little guilty now because they sign up all these things.
Believe me, I'm not perfect at this. I yell at my kid. I lose my cool sometimes. I got to reel myself back. So I'm not perfect. I
think another guilt that we see all the time when parents, when the kids get hurt, is the parents say, man, was there anything I can do to prevent this? Or, like what are some advice you would say to the parents that are going through this right now where the kid just actually got hurt?
Yeah, I mean, injuries happen. And part of orthopedics we have studied, and I'm sure you're familiar with this, we've tried everything we can to prevent injuries. We've tried how to prevent ACL injuries in female athletes, about jump landing and quadriceps angles and all sorts of things about the knee, to everything we can. Pitching protocols to prevent elbow and shoulder injuries. We've tried everything. And as long as you're being a reasonable human, you can't blame yourself for that stuff. An injury is just like any other challenge in your life. It's something to accept that it happened and figure out how you're going to attack it. If you dwell on the injury and that you're hurt and you can't do the things you want, you're going to drive yourself nuts. So it's almost like grieving, the 5 stages of grief. You got to go through the period where you're upset and sad and you don't feel good about yourself. But then you got to move on and move step by step. And that's where having a decent team, a decent physician, a decent trainer, a decent physical therapist, those are all people that can help you in that journey. But the parents' role is to say, look, my kid got hurt. It's not my fault. These things happen. What can I do now to make sure they have the best chance of success? And best things I can do to get them on their way and make them feel loved and encouraged and that like we're going to get better.
Yeah, I think that's such a sound advice because like before we even hop on this podcast, one of my athletes just has a possibility of tearing his ACL, and talking to his family, and just say, hey, listen, let's not jump to conclusions. Let's figure out the worst case scenario, and here's how we're going to build back up. And this is the best case scenario. Here's how it's going to be. I think it's okay to grieve and figure out what's going on, but then afterwards, let's now put together a plan. Like, how do you get the best care? How do you get the best outcome for and what's the future going to look like? And I think as long as the parents are not freaking out, I think the kids are okay. Because it's one of those things when you see little kids run and fall, get up and look at you. Like if you start freaking out, kid will start crying, right?
True. Yeah. I mean, it's another thing too that's kind of getting more and more traction is what we refer to as prehab. It used to be you tear your ACL, you hurt your knee, you wait, you have surgery, and then you start rehabbing. Now, even if you're going to surgery a week or two after the injury, we're big on trying to get patients your way to get them doing things to make sure their post-operative recovery and their physical therapy and their eventual return to sport has the best possible outcome. So things like restoring quadriceps function, getting the swelling out of the knee, and some of that stuff I do in my office, and some of that stuff I need a therapist to work on. Those are things that, early injury detection and then immediate care, those help parents and help kids and help athletes get back to where they want to be.
Yeah, and I think from the mental component, what we figured that if we have someone that stay with us for prehab and then get surgery and then do rehab with us, they're actually the likelihood of them losing that identity as an athlete is actually like a lot lower, right? Because they're still in the same environment. They still get to see other people that look like them going through the same thing.
When they get distracted too. If the instant you're hurt, you have something to do, you don't get to think about being hurt. So if they're right back to you prehabbing and working on their quad and trying to get the swelling down and get their motion back, they don't have that time to sit at home and stare at their knee and go, well, now what?
Yeah. I have this thing where I do with my wife every day is we just go out for a walk and then we just kind of talk through our problems that we have throughout the day and try to solve it. And for me, the coolest thing is the fact that we're in motion trying to go somewhere and solving problem. I think that's the key to life, right? Because in life, we always have problem, whether it's injury or whatever it is. And for all of our younger athletes out there, this is the first time they actually have something that detrimental happen.
Sure.
So to keep them moving, and plus us as a human being get rewarded to move, right? We get dopamine, we get all of that stuff. So if we move and actively seek out solution, it's a really good, physical benefits and also emotional and spiritual as well.
Sure. And I think also part of that is recognizing, like, you can't beat around the bush. One of the mistakes I made earlier in my practice was trying to be too nice to patients sometimes. They'd be like, well, maybe it's an ACL tear. We don't know. We'll see. If I got a patient that comes in twisting into their knee full of blood, obvious Lachman test, obvious physical exam signs of an ACL, I'm not going to sugarcoat it. I'm telling them, look, I think you tore your ACL. We're going to get an MRI to confirm that, and we're going to fix this. You got to have that positive attitude, and you got to be that positive, role model or positive force to drive them. And if you beat around the bush and say maybe, it's more devastating when they find out. Whereas they're expecting the worst and they find out, hey, maybe it's not that, and I was wrong, which I am wrong occasionally. I think it's better for them actually. They know what it is. They get a plan in action. They can start thinking about how to get better, and you can tell them you're going to get better. We're gonna fix this. You're gonna be okay. It's just gonna take time. Yeah,
I think for me as a healthcare provider, and I feel like our job is to tell the truth, because the patient deserve that, right? Because now if we figure out what the truth is, what problem we're dealing with, now we can find solution.
Sure.
If we're beating around the bush, now we're just playing a maybe game. Let's go to the source. Let's figure out what we need to do.
Yeah, and then you feel like you're the bearer of false hope. If you get it wrong after that, they don't trust you anymore. Now you've ruined your relationship with them, which may mean a loss of business, but more so it means that you're doing things that are detrimental to their care and their recovery eventually.
I think it's so funny you mentioned the word business, and like with other provider I talk to who have their own private practice and trying to do the right thing. And I when I talk to them, I say, like, listen, it's not about business, it's about relationship. What I value more is relationship that I get to have with people. These are people who are in their lowest stage right now because they're going through pain. And the fact that they're so vulnerable, they're coming to us, they're saying, hey, can you help us? Can you help me? That's what I value, to be able to meet them where they are. And then from there, just again, our mission statement here is to inspire hope, right? When you're in so much pain, you can't see the future.
It's hard, yeah.
Yeah,
it's like a cloud that comes over you,
Exactly. We just have that conversation, guide them like, hey, there's hope on the other side. Let's go figure that out together. And I think that's why the team approach is so huge, because you have so many people that you can count on.
Well, that's the thing. If you look at our office, we don't decorate our office with Ansel Adams pictures of Yosemite. We're decorating our office with athletes that have had injuries and made it back, because we see that. I mean, it's cool. Patient takes a picture of themselves doing whatever, whether they're in their football game or I have a patient that has this great shirt that says "Make my ACL great again" after ACL surgery. Seeing pictures like that when you're sitting in a clandestine white office with your injured knee, that's the beginning of inspiration. It doesn't have to be from me. It can be from someone you've never seen before, but now you're seeing their picture and saying, well, that person did it. Maybe I can do it too.
Yeah, I love that. So I got another question for you. So obviously we're living in a world of social media, and especially once, kids get hurt, parents immediately think, oh my God, now they're far behind. And with social media, it also make the kids feel even more less than, because everyone's competing, whether they know it or not. What are some advice you can give to the parents out there to make sure that their kids stay positive and not looking outward and try to just focus on their own journey?
Sure. Yeah. I mean, I think one thing that helps with that, and I think this is a struggle I have with my own kids, is trying to get them off social media. Social media, I've heard it described as looking at the things other people do that make you feel bad about your own life and not realizing how good you may or may not have it. No one puts their bad moments on social media unless they're asking you for money, typically. So when you look at social media, it's the best part of an entire experience. You don't see the journey that got them there. So that's why I tell patients, you got to think, and sometimes it's things like keeping a journal or keeping a physical therapy diary or something like that, where you see the response you've had every day. And you can then look, hey, last week I couldn't do this and now I can, to see the positive benefit you've had. Whereas if you look at social media, all you're seeing is that one shining moment and you'll never get there. So yeah, social media is a great tool. You can educate yourself. You can gain experiences. You can see how people do things that are maybe different than yours and land or add to your experience or get more opportunities. But it can't be the be all end all. When we talk about orthopedics is a literature driven specialty, to say the least. I think there's more publications in orthopedics probably than any subspecialty in the country. And that's because there's so much physical side of it and physics involved in instruments and implants and how we use things and surgical techniques, but also because it's a great community of sharing. So if I have a case I'm not exactly sure what to do, I can go online and see 10 different videos of how guys did it. But the more important thing than watching a YouTube video is seeing what the evidence says and how people have shown positive outcomes in not one patient, but hundreds of patients. And that's the key for parents, is realizing in social media, you're getting one patient. You got to listen to your surgeon, listen to your therapist, listen to people that have been through it with hundreds of patients to get that experience that gives you the highest chance of success, not the same as the one person that may be an outlier.
Yeah, I love that. Just because, I have so many, I show you my social media hack is I put everything on grayscale.
I like that.
So then everything just look boring.
I'm seriously, that's like in the back of my head. If I put that on my wife's phone and my own phone, she'll take it off. But
you know what is so funny? Nick's here is recording. I always send Nick Instagram of food, and like, cause he likes to cook. So I was like, dude, next time you cook, make me this. But now when I go on my social media, it's all gray. The food looks horrible. I was like, now I don't want to eat. Like, I'll probably...
it's funny. I actually do that with a buddy of mine. He's an ophthalmologist. I send him drinks we want to make for the next time we hang out outside by a pool or something like that. Like, they're cool drinks that our wives would like, or, that we'd like. And, it's funny. Maybe it'll change that too. I hope not, because that's a fun time.
To circle back on the journal, I started this new habit. I read this book, The Gap and the Gain, by Dr. Benjamin Hardy. And it was more business related, but really life related, because he was talking about like most people measure themselves by the gap of what they don't have. So, and the way he explained it is like the gap is like the horizon. You can see it, but you can never reach it, right? So the best way for us to measure ourselves is actually measure ourselves backwards. So, and you measure yourself backward by keeping a win journal. So for the past few months, I've been keeping a win journal. So every time I come home, before I go to bed, I write like, what win did I have today? And then once a month, I'll go through the journal. And at the end, I say, okay, who did I become this past month that I was not that person a month before? And that gave me so much peace.
So, it's funny you mentioned that. I'm actually an Eagle Scout. I was a Boy Scout growing up. My brother's an Eagle Scout. My dad never made it that far. He made it to Life, which is the rank before Eagle. So my dad was big on my brother and I being Boy Scouts. And even to this day, when I talk to him, my dad's 70 plus years old, he'll ask me, like, we talk once, twice a week, but he'll say, hey, what'd you do? What was your good turn? Because the Scout slogan is do a good turn daily. He'll ask you, what was your good deal today? And it'll be things like, hey, I held the door open for someone, or like I picked up something that someone dropped, or like little things about your day, like little experiences you have that make your day better or make people's lives better. And I love that. The other thing is, there was an old book years and years ago, back when I was doing my research fellowship, called The Secret. I don't know if you remember that.
Oh, yeah.
It was like a big movie. And my wife tried to get me to read it for positive thinking, and instead I watched part of the movie, and I took a part of that I really liked and helped me kind of get where I am. When I was doing my research, I was very apprehensive about what my life was going to be. Was I going to get into orthopedics? Was I going to do the things I wanted to do? And one of the things they talked about in that book was making a picture, like a montage almost, a single page of notebook paper. And I think it was like 10 pictures of things I wanted. And I still have it somewhere. And it's like little things. Like I was going to Vail for the year, so I wanted a good snow year. So I put a picture of a guy jumping off a snowboard into huge amounts of powder. And I wanted to get a handshake when I got my orthopedic residency. So I had a picture of two guys shaking hands because I wanted a handshake from the guy I was working with. And it was amazing going back, a year or two later and looking how I crossed off every one of those things. And that was something that was on the inside of my front door in the apartment I lived in. Every time I'd walk out, I'd see it. When I would come home and I'd close the door, I'd see it. And it wasn't like I studied it, but every day I saw it to remind me, these are the things I want, and this is what I got to do to get there, or how am I going to get there? So same idea, win journal, goals, all those things just keep you focused and to refocus you at some point throughout the day. So you remind yourself, I got to get back on track with what I'm doing, and maybe, stay off Instagram or not play video games or watch TV all day.
Yeah, I love that, because it's my favorite book is right behind you, Think and Grow Rich, and Napoleon Hill talked about having a definite sheep aim, which is something that you're aiming for, right? And the crazy thing is that when you aim for something, doesn't mean you need to know how to get it.
Right.
As long as you have an aim, you're like, okay, that's what I want. All right, well, I'll figure out how to get it, because I think that's life in a nutshell. And what I love about what I get to do, and I get to interact with the patient every single day, is that they have a definite goal that they want. They're in a state that they don't know how to get there yet. And my job is just like Gandalf. I was like, hey, Frodo, here's what we have to do. We got to go do this and this and that.
And
right?
that's something no one can get to where they are by themselves. If you try and do it by yourself, you need help. You have to be willing to ask for help and be open to suggestions, or otherwise you're never going to make it. It doesn't matter if you're the best at what you do or the worst at what you do. Everyone needs a hand sometime. Yeah.
Side story before we close it off. My wife had that whole thing, the whole secret thing, when she was in grad school getting her doctorate. And one of them was like, the car she wants, like the degree she wants, all that, and then like engagement ring. So when I went to propose to her, it was funny because I took that picture of the ring down. I put the box of the ring next to the picture, and that's how I proposed.
Nice.
So going back to
Cool.
to the secret. Yeah. So last question. I like to end with this. So if you were to be able to make a fortune cookie company, and what would the message inside the fortune cookie say?
Ooh, that's a good question. I think throwing back to Boy Scouts, I think it'd be an advice thing, not necessarily like this is going to happen to you. I think it'd be positive advice that helps you achieve your day. So something like doing a good turn or treat people the way you want. I'm big. I always describe myself as I'm the ultimate optimist. I expect people to do the right thing. So do the right thing would probably be that fortune. Mm-hmm. And what's funny is I tell my wife this is when I get angry or frustrated with people, it's usually because they don't do the right thing. Or they don't do what I expect them to think is the right thing. And that's hard for me to understand sometimes. And that's a major character flaw because, sometimes there's an old term. It's called having an FU chambered. You got to be ready to tell someone, hey, F you. And I don't have that ability. I'm working on it. I'm trying to do, but I expect people to do the right thing. So I tell them, hey, thanks for good job. So do the right thing. I think that's the simplest slogan, the simplest motto, the simplest fortune you could have. And if everyone kind of use that golden principle, we'd probably be a lot better off. But you got to expect every once in a while to have that chambered round of, hey, get out of here.
Yeah, I love that. In my office, I know you saw, I have the saying similar to yours, like do the next right thing.
Yeah.
Right? Because if you say like, oh, do the next right thing, that means I'm already doing the right thing. Then what's the next right thing?
I like that.
Right?
I might adapt some of that.
So you just keep, future casting it the whole time. And the one thing, I get the same thing as you. I get disappointed in people, but I'm just like, I need to let go of that external thing, right? Because I can't control what's going on the outside. I can only control what I have. And if I do the right thing, hopefully if I do enough right thing, then people around me can be like, oh, okay, that was the right thing to do. Why do I try that?
The same way is if you set the right example, you do the right thing, people will see it. And not everyone's going to conform and do it the right way, but if you get a couple people to do it, it's a chain reaction, more and more people, and hopefully gets everywhere.
And if they don't do it, that's okay, because it doesn't affect you, right? It doesn't make you do less of the right thing.
Exactly.
So, Casey, thank you so much. Before I let you go, where can people find you?
Yeah, so my practice is Academy Orthopedics. We have a bigger overriding group we've formed recently known as Ortho East. Both of those are easy to find online. We have a big social media, big online presence. My office number is 973-446-7500. Or, my cell phone's readily available by most people. You can give me a call anytime.
Perfect. And we'll put all the contact information in the show note. Guys, I hope you guys enjoyed this episode. It's been a pleasure for me. I mean, I can probably keep going for like the next 3 hours. So, I hope you guys take away. And if you guys like what Dr. Pierce has to say, reach out to his team, contact with him. And again, thank you so much for your time.
My pleasure, man. Thanks for having me.